Hi, in this video, I'm going to show you what 2025 looked like without using health insurance. We are members of Samaritan Health Sharing Ministry, and in this video, I'll show you what that looked like month by month, what the shares cost, what the cost of the doctor visits, and what an ER visit cost, as well as some medications. At the end of the video, I'm going to compare what 2025 likely would have looked like cost-wise had we used some of the health insurance options that my husband's work offers. So I hope you find this video informative and especially helpful if you are looking into health sharing but aren't so sure about the cost, because it's not something that's going to be likely stable month to month. But in the video, I think you'll get a really good idea of what you can plan for if you're going to start using health sharing. I also made another video about Samaritan Health Sharing in general, and I think I'll link that below. So I hope you enjoy this video. Thanks. Some things I want to clarify are that we are a large family. I have 8 children still at home, and we live in a high cost of living area. So let's look at January. Our share that we send off to another family was $855. The pharmacy was mostly over-the-counter type things, and that makes a total of $901. In February, our share was $822, and again, more over-the-counter things at the pharmacy for a total of $842. March was a little different. We did send off our share, but we did get a payment from a need from last year, so that was nice. And then I couldn't remember what I kept track of for my husband, but it was $32, so this was probably some type of supplement or over-the-counter thing at the pharmacy. In April, we had another share at $821. Our pharmacy costs were $22, and we did have an urgent care visit for $125. Probably that was what I ended up buying things at the pharmacy for, and the total was $968 for April. In May, another share at $858. My adult son had a doctor visit, and I'm not quite sure if this was the whole cost of the cash pay visit at the doctor or if he helped some. But we did have a pharmacy visit, and then also the pediatrician. This was for, I think, a well child visit. And just to clarify, all doctor visits here are going to be what I was billed, the cash pay price. And so the total for May was $1,206. In June, we had our $871 share, a dermatologist visit for my daughter, which was $175 total. The pharmacy cost was $45. And so the total for June is $1,131. I do want to clarify that during this calendar year, 2025, the initial unshareable amount for Samaritan Classic members was $750. That means that for any medical event, the first $750 was something that we're expected to cover out of pocket. After that $750 threshold was met, then I could submit the bills and the group would cover it as long as there were funds in the network. This year now, though, the threshold has been raised because just everything is raising in prices. So now the initial unshareable amount for some type of medical event or condition is $1,000 for Samaritan Classic members. So when you'll see on these bills that I'm showing, a lot of them, to go see the doctor, it is $100 to $200. And that's just something that when I go to the doctor's office, I'm prepared to just pay that myself. I'm not typically expecting it to run up high enough to become a bill that I share. So in my monthly budgeting or planning, I am trying to make room for having some doctor visits that I'm expecting we will be covering. And that just goes into my mind for the general total of what I can expect to pay every month. Now, July. July was a doozy, and this is largely due to my own panic. So let's get into this. our share was $896. Pharmacy, and when I say pharmacy, it's usually just a CVS or Walgreens type store. That was $34, just random over-the-counter things, Band-Aids, that kind of stuff. My son had a doctor visit at $200. And if I remember correctly, this was for my adult son, and that might have just been my helping share, and maybe he covered the rest. I can't really remember, and I didn't make a note of it. But okay, this is the emergency room. So my daughter, who was 7 at the time, stepped on this upholstery tack, a really big nail outside, and she was screaming. It was sticking out of her foot, and I could not pull it out. I tried 2 times, and I probably just wasn't pulling hard enough. But I started panicking because I thought, I don't know what this thing is. I thought maybe it had barbs on it or something, and I just didn't want to yank and cause severe damage to her foot. It was sticking out of her heel. And so I just took her to the emergency room. And after they looked at it, they even did an x-ray, because I told them, I said, I don't know how long this thing is or if it's curved. I didn't see the object before she stepped on it. And so maybe they were humoring me. I don't know. But in the end, it was just fine. It was sticking in her a little bit, but they just pulled it right out and, put some antibiotic on it. So if my husband had been home, or even one of her older brothers, I think they could have more calmly just pulled it out. But it is what it is. I was concerned, and I even thought about tetanus, but they seemed to be really not worried. It was not that deep of a puncture. So anyway, these are the costs that I ended up paying myself. And an enlightening thing is, these are 3 different costs. I think one is the physician's cost. Another one is the imaging cost. And then the big one, $846, is the actual hospital billing me. What I did with each bill, though, is I, like Samaritan encourages you to do, I called them on the phone. All these bills were higher when I got them. And then I asked them for a discount. I did not say I had financial hardship or anything like that. And they also asked me if I wanted to be on Medi-Cal or something like that. But no, I said I'm part of a health sharing group. I'm just wanting to see if there's a discount. And I believe that ER visit was probably discounted 50 to 75%. So that ER bill was closer to $2,000. So the numbers you see here are what I ended up paying, and I just paid those myself with our credit card. And that's how we normally just pay for a lot of things. And then I also had a doctor visit, and that was a physical well woman type visit. So in the end, July was a big month for costs going out. Here's some proof that I do tend to panic sometimes. And so this was largely due to panic. This is the screenshot of the Samaritan dashboard with my need showing, and it shows that the first part of this bill, the $750, is unshareable. That's something I'm responsible for, and then that the shareable portion is about $555, and that is what I could expect to get back later from other members. And so if you'll notice, this was the first time for the calendar year that I had bills that exceeded $750 for a medical event that I could expect reimbursement for. So I paid the bills, but then I scanned the bills and uploaded them on the website and got that process going. So in August, we had our share of $928 and 2 pediatrician visits. I think these were just physicals. I had wanted all my children to get physicals because we hadn't done it in, I think, a few years. So I also had lab work. This was blood work that I had been recommended to get from that physical that I got myself. And so that was the bill. I believe I called for a discount, but they might not have been able to discount it all that much. The total for August was $1,683 in healthcare expenses. In September, we had our health share of $920, 2 well child visits, and then the total was different because I received the $542 of reimbursements from other members. And so in the end, I calculated our final cost of health care being $844 for September, and we were reimbursed via PayPal. Now the system is a little different, and you can have a direct payment and direct deduction from your bank account. And I believe Samaritan's actually doesn't use PayPal at all anymore. Okay, so here we are in October. Our share that we sent off was $880, and then I had 2 pediatrician visits. You'll notice that the visits for the pediatrician have increased in price over the year. I think that my first visits were lower because I challenged some type of fee that they charge me after. Normally, when I go to the pediatrician, the bill is paid right there because they won't see you unless you pay first. But then they sent me a bill later, and so I challenged that. And the first person who I had spoken to took that extra fee off of my bill. But then the next time and the time after that, I realized that it's just something routine that they do after. And so I just stopped challenging about that. And maybe they raised their prices a little over the year at the pediatricians. I'm not sure, but those are the visits. So the total was $1,382. I also want to add that during this fall season, I caught my children up on some of their immunizations, but I don't do it at the pediatricians. There's another office in my city where the immunizations are free or extremely cheap, so I do that there instead because immunizations can cost hundreds of dollars per shot. So now we're in November. Our share was $937, and my son hurt his ankle. We thought it might be fractured or sprained. We weren't sure, so I took him to an urgent care that had x-ray in the facility. And that's one thing I would like to recommend. If you are going to do a visit, just try to go somewhere where they can do what you want them to do. So I make sure that I pick urgent cares that have an x-ray machine in the house instead of one that would refer me somewhere else, because then you're going to have to pay another doctor visit fee for that. So that brings the total for November to $1,230. And you can see that this urgent care visit did not result in more treatment. They gave me some crutches, or actually I did purchase those, and that was part of the fee, and his ankle was just sprained. And now those crutches are in my closet, and my children really like bringing them out and playing with them. I think they were about $30 for adjustable, good quality crutches. And so we had needed them, and I just figured it was easier to do that versus buying them on Amazon. December, our share was $921. We had a medical imaging extra fee that might have been from my son's sprained ankle at $16. I probably did challenge that price and got it down to the $16. And then 2 checkups and a pharmacy visit. And now this was very interesting. So I took my daughter to the pediatrician 2 times, and it was for the same thing. She kept getting swelling. Twice it was near her eye, and then it started happening in other parts of her body due to bug bites, but I was very concerned about the swelling near her eye. And the visits really weren't that helpful. She basically was like, don't worry about it, but it looked so bad. The swelling was so big. And so then the third time, I decided to try Amazon Health. I saw that they could do some basic care, not a lot of things that they could diagnose or treat, but I thought, why not? And that appointment was so helpful. It was a nurse practitioner who did it. We did it via Zoom. I submitted pictures. For the $49, I felt like it was better than those 2 pediatrician visits. And she didn't prescribe anything necessarily, but from her guess, it just seemed like an allergic reaction or like a reaction to the bug bites. And she recommended allergy pills, just over-the-counter allergy pills for my daughter. And they ended up being very good. They brought my daughter relief. And so I feel like her diagnosis was very helpful. So I'm keeping that in mind from now on, that Amazon can actually be a great, extremely low cost method for some minor physical problems. Also, it was very quick, and the waiting was quick, and the visit, I feel like she gave me as much time as we needed. So maybe I just got a great nurse practitioner on that Zoom call, but I highly recommend it. And I don't know if you need to be a Prime member to do that. Maybe they charge you a little bit more if you don't have Amazon Prime. The total for December was $1,306. So for the final analysis, I spent $13,208, and that included my shares, my cash pay, doctor visits, and then one medical event that was over the threshold of $750, as well as our small pharmacy visits. And so how does this compare to other programs? So this was just an AI analysis for family coverage in California. The premiums cited were $28,000 to $33,000 for employer-sponsored coverage with deductibles up to $12,000. Now, things can, they could be wrong, or maybe looking at some of the highest top-tier health insurance that might be skewing these numbers higher. And so, and then there's some subsidized plans through Covered California. So there are a lot of factors to consider. I decided to look at the healthcare options given through my husband's work. Now, his work coverage is interesting, and we don't really like it. Basically, he gets an allotment from his employer, and that allotment can cover most of the healthcare options that are given for just him alone. But if we want to put our family on it, then that's going to mean we're going to go out of that allotment amount, and we're going to have to be taking more out of the paycheck. Now, at this point, we would actually prefer him just to not be under the employer-sponsored health coverage, but they won't let you. They won't just let you have that money that they set aside for healthcare and keep it. So he's on it, and we just try not to have our paycheck taken, cut into anymore to put our family on it. But if they change that policy, we'd really like to. I guess there are many people at his work that would rather not have that system and would rather just have that extra money given to them because they're already covered on their spouse's employer-sponsored health coverage. But that's the way his school district does it. The first plan I decided to look at was the Kaiser $20 copay plan. If my family was on this option, we would be responsible for an extra $16,247 to be taken out of my husband's paycheck. The total amount of the doctor visits that we had in 2025, including emergency room, came up to 220. So what I did is I just calculated what it would have cost for all the visits we did last year. And so that gives us a total cost of $16,667 for that plan. Next, I decided to look at the Anthem Classic HMO, which I think wouldn't be as nice as Kaiser. I had really liked Kaiser when we used it, but with that plan, the cost would be lower. The premiums are lower. The copays are a tiny bit higher, but in the end, we would have been spending out of pocket last year $14,859. And again, my husband's work contributes some, but not all, for our whole family to be on the insurance. And then the Anthem PPO was the priciest one because you're getting that PPO with the additional options and doctors. That premium came up to $21,691 for what we would have spent over the year 2025. When I look at the three options, if I was just trying to get the closest in terms of price, comparing health sharing with Samaritan would have been most comparable to the Anthem HMO plan. Now, the difference is, about $1,600 of a price increase if we had gone with Anthem HMO, but also our options would have been limited. With Samaritan, I go to the doctors that I choose. I've never been turned away from a doctor, and I really like that because certain offices or specialists, I've just found that I prefer. So that would have been difficult being more limited on the HMO, but I can see that an advantage of the HMO and these other plans is that it would be more predictable. I understand with Samaritan, if we have some catastrophic, multiple high cost bills, we could really be in trouble one day. So there is more security in that. And then another thought that I want to explore is why not covered California? In California, health insurance is still subsidized based on income level and family size. And with my very big family size and income level, I think we still would be eligible for subsidies according to the AI overview. And for me, I guess this just comes down to personal beliefs or preferences. We can afford to pay our health insurance costs. And even if things rose more or we had several expensive health needs, I think that all things considered, we probably would be okay. So that's just how I approach things. In California, for many years now, my family has gone in and out of being eligible for a lot of discounted things. And in the beginning of my marriage, my husband and I were on Medi-Cal, and basically all our health care costs related to pregnancy, childbirth, those were free, again, based on our income. And it wasn't until after my second child that I started learning more about health insurance and options. And I just didn't know a lot back then. And so I realized, oh, like this is just something I could pay for, even though my husband didn't have a job that was offering health insurance at the time, that we could just do this ourselves. And so I realized it was something we could afford. And so even though we qualified back then still for subsidized health insurance, we just decided we'll pay for it ourselves. And so that's the approach I still have today. Like, even though I think at times we've been eligible for the WIC and like SNAP benefits and different things, we've just had the mentality, if we're able to provide for it ourselves, we're just going to do that. And I don't fault any family who needs to use these resources. I think it's great that there are so many easily available helps for people, but in our situation, we just budget, pay for things ourselves, and we like to be able to also help other people. And so we just choose not to use those things. So I didn't take the time to go down into the whole Covered California options and see what our cost could possibly be. It's very likely that they could be a savings over Samaritan Health Sharing. But for all those reasons I just stated, it's just really not something I'm interested in. I really like how Samaritans is something that is an alternative option. I like that it's people helping people, that it's not for profit, and that while my family is on the higher cost end of this, we are just a bigger family, and we're also paying for the extra Save to Share, which covers medical needs above $250,000 if that were to ever happen. It's expensive, but I've just found over the years raising a large family is expensive, and so I'm okay with that. I like how Samaritans has these other options that I'll show some pictures right now, where people in different situations can get health coverage for much less. And so, whether it's just one person or two people or with a smaller family, that there are much lower options available. We basically are at, I believe, the most expensive tier. So that's something to think about. If you have a smaller family and you're looking at these numbers and just thinking it sounds crazy, just look at, maybe think about it for what your situation might be. And it's very, very likely that you will be paying less. I think this was very helpful for me in reflecting on the way things have changed. I will totally admit, like back years ago, Samaritan was so much less expensive than the healthcare options through my husband's work and that I saw available on the open market. It was a great deal, and their coverage was better in terms of, I believe, the maternity care. It was covered at 100%, whereas now I think it's more like 70% coverage, and the out of pocket responsibility was so much less. I think it was $350 or $400 when we first started. And so it was great. It was truly this really great deal. And now that I'm comparing and looking, it is a lot closer to some of these lower, I guess, HMO options, these lower option health insurance plans. And so it's maybe not as great of a deal, although as you can see in my comparisons, it still is a savings. I think for me, I am just going to continue on with it because I love it. I love the way this option, which is what it gives to us. I love having an alternative. And also I do think it really helps some of the families on the smaller size families and maybe younger families. I just think it's great to be part of this. And so I'm going to continue on with that. But one thing I am going to change is I am going to start budgeting a lot more for the monthly expectation of costs, and with the mindset of, I'm obviously probably not going to hit a higher budget every month. Right now, I have been budgeting about $1,300 every month for medical costs, but I think that number needs to be higher, and just saving more, because now the out-of-pocket expectation for Samaritans is $1,000. So it's a lot higher, a lot harder to absorb as easily. So I do think I need to put more into savings. And I am looking at Samaritan even more as like something that's more similar to a high, like the catastrophic high deductible health insurance. It's more comparable to that, where it really is for things that are just going to be the bigger items. A lot of the routine care and all that's going to really be on us. And if there ever is a truly hard year or sad situation where maybe many of us need medical care, like it's going to get really expensive and probably far exceed a traditional midline or mid-range health insurance plan. So I just need to prepare for that. And I think with that adjustment and tweak in budgeting and expectations, I think that this can make this program work for the long haul for us. And as time goes on and my children grow up and ideally have their own families, then we'll be back to those, the smaller tier. Because if you notice, Samaritan does do pricing based on the number of people in the program. So that's likely going to go down over the years. And if things really, truly don't work out, I'm not against health insurance, and I could see possibly switching over to a plan one day, but I think that this could still really work for us. It just requires some thinking differently about how to approach this and realizing that it's not as great of a deal as it used to be, and that's fine. And lastly, I should have added this earlier in my numbers, but throughout the video, you'll see how I had 300 or about a total of about $350 for pharmacy costs. And that's something that was in my Samaritan's estimate, or when I accounted for what I spent with Samaritan. But that number would have also, I'm pretty sure that would have been added onto any of the health insurance plans I was also comparing Samaritan to, because those were just over-the-counter, non-prescription things. I don't even know if we had a prescription for really anything that into 2025. And so those are the kind of things that I wouldn't have had provided, that health insurance wouldn't have provided that for me. And so that's just, that cost is the same for Samaritan or health insurance. So this is a long video. Hope you found it helpful. If you have any questions, please send or add a comment down below. And I hope this video helps you in sorting through what the best health care option is for you. God bless you. Have a great day or night.